I'd like to call the Davie County Commissioners meeting of July 10th to order. At this time, if you would join me in the invocation. Dear God, as we come before you this evening, as always, we're so thankful for the many blessings of life. We're thankful for the right of self-governance, and we're thankful for everything we have here in Davie County. We remember the people in the community that are sick or in grief due to the loss of loved ones. We remember Kirk Dickens and his family. Be with them this time of grief. As we move through the events of this evening, we ask for your wisdom and guidance. In your name, amen.
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 We stand and join for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, we got a good crowd tonight. Appreciate everyone coming out. At this time, before we adopt the agenda, I understand we have a slight change to the consent agenda.
Yes, Mr. Chairman, and just by way of background, there's been a tremendous community effort in terms of bringing an agreement with respect to the river park in Coolamy and the power plant there and the community of the town of Coolamy and the county itself. And we have an agreement pending tonight, but there's been a small amendment necessary to the agreement to ensure that the intent of the parties is reflected to allow for the water to flow across the entire dam over weekends and holidays so that the public can enjoy that and have the water coming across the dam. So the proposed amendment would be to the consent agenda, item number 9E, number 3, which is entitled Agreement, on page 2, paragraph 4, where we would delete the third sentence and substitute in its place the following language. Such water flow shall be at a minimum rate of 60 cubic feet per second, or any greater amount it may take to ensure there's water flow across the entire dam area, so long as there are no drought conditions in Davie County, period. And then the other amendment would be to reflect that if there was some act of God, or what we call force majeure in legal terms, some unexpected event where the dam was blocked by logs or other things that would prevent the water from coming across the dam, that would be basically an exception to this water flow condition. We wouldn't expect that to happen, but it's conceivable it could happen, so we want to be respectful of all the rights of all the parties. So we would ask our attorney to include a standard force majeure clause in the contract in the event there was an act of God that would prevent performance under the contract. So I would make that motion to amend the consent agenda accordingly.
Okay. I have a motion to change the consent agenda as laid out by Mr. Barrett. Do I have a second?
I'll second it.
All right, I have a second. Before we, any other discussion? Before we call
Just a
for the
brief question, Mr. Chairman. There's been quite a bit of discussion in this process, bringing this agreement together. Have both parties been?
I can comment on that. I did have a conversation with Mr. Bullock today, and he's here tonight. We wanted to make sure that his needs were heard in this, as well as the River Park Board representatives are here tonight. This language ensures the intent that both parties have discussed, and so we feel positive about those things, and any of them here who wish to speak can obviously do so if you ask them tonight. So I do feel compelled, in addition to answering your question, Commissioner Jones, to say no one understands how much time and effort have gone into this, from people in the town of Coolamy that we've heard from, citizens there, people on the River Park Board, and with South Yakin Power and Bullock Development. It's taken a team effort to get us to this point. We're very happy with where we are and trying to get us to a phase 2 of that River Park. So to answer your question, yes, all parties fully understand what we're talking about. And I'll defer to them if anyone wants to speak.
And I think the intent the entire time was to have the water come across the dam, and then there was questions about what water flow would do that. See, we have a metric that nobody, at least I don't understand it, but
Correct.
we all understand water coming across the dam. So that's really what we're trying to accomplish. And thank you, Mr. Bullock, for your work on this.
All right, any other discussion, questions? All right, before we take the vote, you can see that we only have 4 of us this evening. Mr. Poindexter, Commissioner Poindexter is traveling on business, and I meant to say that earlier. So anyway, he will not be joining us. All right, with that, all in favor of the change to the consent agenda, raise your hand. Okay, that passes 4-0. All right, now entertain a motion to adopt the agenda as amended.
So moved.
Motion to have second.
Second.
Second. Any discussion? Not all in favor, raise your hand. Okay, thank you. That's 4-0. All right, next we will move to the public comment period. All right. Next we move to a proclamation of recreation and parks. Mr. Moore or Mr. Eller, okay?
I'd like to ask our Recreation and Park staff to come up front, if they wouldn't mind. I want to recognize them. We have a proclamation for July being National Park and Recreation Month, and so I'm going to read a proclamation, and then I'll let Mr. Moore say a few comments in honor of what the work that he and his staff do each and every day for our county. So, whereas Recreation and Parks program are an integral part of communities throughout this country, including Davie County. And whereas our recreation and parks are vitally important to establishing and maintaining the quality of life in our communities, ensuring the health of all citizens, and contributing to the economic and environmental well-being of a community and region. And whereas recreation and parks build and enrich healthy, active communities that improve the physical and emotional health of all citizens. And whereas our natural recreation and parks areas ensure the environmental well-being and ecological beauty of our community, and provide a safe place for children and adults to connect with nature and recreate outdoors. And whereas the U.S. House of Representatives have designated July as Parks and Recreation Month, and whereas the County of Davie recognizes the benefits derived from recreation and parks resources. Now therefore, be it resolved by the Davie County Board of Commissioners that July is recognized as Park and Recreation Month in the County of Davie, North Carolina, dated this 10th day of July, signed by our chairman, Mr. Terry Reniger. And we just thank you for the work that you do. So, Mr. Moore, do you want to say a word or two? Thank you.
Thank you, Mr. Eller. July, again, National Recreation Park Month. It's an exciting time for the association. There's quite a few challenges that are out there. I implore all of our residents to visit nrpa.org. Look up the July Parks and Recreation Month, see all the activities that you can do. The basic premise of this is to get out and enjoy parks and recreation and leisure services at its best. Visit your local town or municipal or county park. Get out, see some nature, see the beauty of what it beholds. And above all else, along with our mission and vision, is providing an enriching active movement for all of our residents. So I want to thank our residents that are involved with our programming each and every day at the Brock Recreation Center. And thanks for all of those who came out for our Independence Day celebration July 1st. It was a great event, and had a really good time, and enjoyed that partnership between many entities, including the town of Moxville, PD, and so many others that took part in helping us pull this event together. Thank you.
Thank you. Mr. Moore has taken the Parks and Recreation Department and is definitely very assertive in his goals, and we look forward to seeing where we go with this. So, thank you. Next, we have a couple presentations. The first one is an update on the Baltimore Road interchange, and Mr. Meadwell, or I'm not sure who's actually presenting.
Thank you, Mr. Chairman. As a result of this board's or the previous board's decision to ask staff and the Winston-Salem MPO to look at an alternative to an interchange study on I-40 between Redland Road and exit 180. Before you tonight is the final draft of that study. So I'd like to ask Dylan Turner from Kimley Horn to make this presentation to you, and if you have any questions, we'll be more than glad to answer those.
Good evening. I'm Dylan Turner with Kimley Horn, and the presentation I have before you is for the Davie County Transportation Feasibility and Impact Study. All right, the first slide we have here is the project study area that we analyzed on I-40, US 158, Baltimore Road, Redland Road, and NC 801. And this includes I-40 exit 180, which is 801, and I-40 exit 174, which is Farmington Road. This shows the environmental constraints in the area. A lot of what we saw was streams and wetlands, and part of it, environmental constraints includes historical homes. So there's historical homes and buildings in the area that we saw as well. These are the FHWA criteria, Federal Highway Administration. Their criteria to evaluate new and existing access locations onto interstates. They include need for access cannot be met by the existing interstate interchanges, reasonable system management techniques, and geometric changes address the need, no adverse impact on the existing interstate and interchanges by the proposed access, proposed access connects to a public facility, access proposal is consistent with local and regional land use and transportation plans, and a comprehensive evaluation of the corridor is required in locations where multiple interchanges are possible. Coordination with the proposed transportation system improvements and proposal for access must be developed concurrently with the environmental evaluation. So this kind of zooms out of our study area, showing the 6.3 mile study area we did along I-40. And the gray box zooms into the area where the most feasible location of the new interchange would be. It's looking at Redland Road back towards NC 801. And for us, the most feasible area encompasses Baltimore Road, which was determined to be the most feasible location for a new interchange. And I'll discuss that in a few slides as well. And this zooms into it. It's more of a finer grained detail. We recommend extending Baltimore Road to the north. The new interchange can extend to Redland Road per NCDOT suggestions. Redland Road was not feasible to be an I-40 interchange because of historical homes and buildings. Redland Road also does not pull the heavy vehicles off of US 158 like Baltimore Road would. Baltimore Road directly accesses the Ashley Furniture warehouse site. And the Baltimore Road extension would run through a relatively undeveloped area and go into I-40. These are the three alternatives we looked at for the proposed Baltimore Road interchange. Option 1 is a standard diamond interchange which connects 158 to 801. Option number 2 is a standard diamond interchange which connects 158 to Redland Road. Option number 3 is what we call a trumpet interchange, and it would connect 158 to I-40 as a part of phase 1, but it does not limit the connection to either Redland Road or 801. That would be later on down the road as part of phase 2. So what we have up there is phase 1. We have a diagram for phase 2 shortly. These are our 5 key options that we looked at for each alternative. We looked at accessibility, impact to natural features, built environment impacts, driver expectations, and operations. This is a concept level for the Baltimore Road and I-40 interchange. This is what we call Trumpet Interchange. So this would be phase 1. And that's to help with the feasibility of the project. And then phase 2 was a suggestion by NCDOT to connect to Redland Road, which is seen here. And as I said, NCDOT wants an extension to 801 or Redland Road. But after looking at the alternatives, Redland Road would be a more palatable option. Here you can see the extension of Redland Road. There is a slight realignment of Redland Road in the upper left, and that is to help the vehicles coming off of I-40 move through the corridor more effectively. So we did not only just look at interchanges along I-40, we looked at a few intersections as well. This is the proposed improvement to Baltimore Road at US 158. Our recommendation was to have this intersection as a signalized intersection to minimize the impacts to adjacent land uses. Here, and we looked at the high congestion areas, and this would be NC 801 at US 158. This improved concept includes dual eastbound left turn lanes on US 158, which would be, don't know if you can see my cursor too well, but here, dual westbound left turn lanes, and additional north and southbound through lanes for capacity and moving vehicles along the corridor, and channelized northbound and southbound right turn lanes to allow for vehicles to yield instead of being under signalized control.
Could I ask you a question?
Yes, sir.
Do you have any numbers of how many vehicles are moving through this intersection daily?
I have numbers in the report. I could grab that and show you.
Yeah, I don't have to.
Okay,
have it on
all
there.
right.
That's good.
Yeah, they're all of this, all the concepts and everything are based off of numbers that we use to analyze these intersections. So the concept's the final product. We also looked at the potential for a roundabout at this intersection of 801 and 158. The previous intersection, so just adding lanes and turn lanes and through lane, actually worked better than the roundabout. The roundabout also has greater property impacts and right-of-way impacts, so we preferred the signalized intersection improvements versus constructing a roundabout. Yep. And so this is I-40 at Farmington Road. And as you can see, we're recommending to install 2 roundabouts at the ramp terminals. Based on conversations with NCDOT, there are no plans in the near future to widen the bridge along Farmington Road over I-40. Therefore, any turn lane improvements would be hard or even signalizing, so roundabouts would be effective. And due to the new high school in the area, we feel like this offers the most increase in capacity while minimizing project cost, because we're not affecting the existing bridge. And here you see at I-40 at Farmington Road, or excuse me, this is Farmington Road at 158, and this is another roundabout, and this was proposed with the NCDOT spot program, and we agree with their recommendation as well, the roundabout is moving the vehicles through the corridor better than a signal would. And this is a larger detail. So this is kind of our full study area along Farmington Road. And what it shows is a 3-lane section. So if you have 2 through lanes and then a middle turn lane, we call it a 2-way left turn lane. And that would allow for buses to turn into the schools easier along Farmington Road and allow for the heavy vehicles to turn into the rock quarry without interrupting the through vehicle flow. Our next steps would be endorsement of the study from the county, the MPO, and Bermuda Run. We would work with NCDOT Division 9 to get selected projects into the STI 5. And we would work with NCDOT and FHWA to submit the interchange project for a fast lane grant. And the fast lane grant would be for really the heavy vehicles and getting them moving on I-40 more efficiently and getting to I-40 more efficiently. And based off preliminary discussions with NCDOT, the project does look favorable to get the fast lane grants. Do you all have any questions? Or if you need to see something else, be glad to show it to you. I'll show you something again.
The fast lane grants would just be, speak about that a bit more. Is
Okay,
that
it's a federal grant.
Okay.
So it's going to be through help with NCDOT and FHWA, and it is strictly for like transit projects, and transit would include heavy vehicles, so 18-wheelers. So you've got a large Ashley Furniture site that is they have to divert kind of to get to I-40. They've either got to go Farmington Road or they've got to go up to 801. So if we can prove, which we have, that having this new interchange helps the heavy vehicles and helps commerce in the area, then it helps our argument for a fast lane grant. And so it would be a way of funding for the interchange.
How much of the funds does that pay for?
That would have to be kind of agreed upon. That hasn't been determined at this point.
So, like with the state, when you apply for projects, you get on a list, and based on how the scoring gets, you moved up. How does that work on the federal side?
You'd still have to make a list, and then you'd be declared for a funding year. And it's a similar process in which you write up everything for the grant, and then they would say, okay, here's where we're going to put you on the list. Here's when your funding year is. So that's the same type of way. I mean, we'd go through NCDOT. It'd have to be adopted by NCDOT and then put on a federal grant as well.
There's probably not an answer to this question depending upon where it gets scored, but what's a typical time frame for being awarded a fast lanes grant?
I'm not sure. I can look that up and send that to you if you like, but I'm not sure this time.
Okay.
The fast lane grant is a newer grant, so
Okay.
I'm not sure on their general timelines.
Have you had any conversation with DOT about this study?
About this,
Have they
yeah.
given input already?
Yes, they have, yeah. NCDOT reached out to us, and really the only comments that they had was they wanted us to study a 2040 horizon year. So we had 2025 initially. I think you all may have seen this report previously, and only went to 2025. We had to go out to 2040 to see what the project impacts were in 2040, and we had to add the rest area, or a truck stop into the, I think it was a rest area. No, yeah, it was a rest area, into the truck stop, or into the study. So that was their comments, and that was pretty much it.
I see 3 projects here. You got the Baltimore Road project, you got the Farmington Road project, and you got the 801-158 intersection. Now, are you recommending all 3 of these be done, or what's the process here? What are we?
So
what are we
this is a feasibility study. So we received a study area for these projects. So these are multiple projects. So it just shows what's feasible within the area. So the fast lane grant I mentioned earlier would be for the I-40 interchange with Baltimore Road. The other projects would maybe be a STIP project on NCDOT. It's just recommendations we found in the area that could help traffic at several different locations. So next step is what we said here. So work with NCDOT Division 9 to get projects into the STI 5. So that's just working with them to adopt projects onto their funding list.
Well, as I see this, the Baltimore Road project would take the heavy trucks off of 158, going to Farmington Road, and also going up to the intersection 801, 158.
Right,
So there would be some relief in both of those places
right.
by doing the Baltimore one. And I would assume that it would be put some kind of an order somewhere. Baltimore would be priority one, and the intersections.
That still could be determined. I mean, through this study, our main focus would be Baltimore Road, because that would be the biggest cost to go through and do a new interchange onto I-40. But as far as the prioritization goes, that hasn't been determined. We're strictly showing the feasibility of each of these projects. So a part of this study is not to focus on one project. It was to focus on multiple projects within the area.
Well, I would certainly be interested in those numbers we're talking about going through that intersection, because if driving through there in the afternoons and the mornings, it's very, very busy.
And John, if I can just kind of, and when we talk about the 2025 horizon and to 2040, we're talking about those conditions at 158, 801 at that peak time. So basically, as Commissioner Reniger had mentioned, this allows the county to justify projects for an improvement there at 158, 801 to score better as a feasibility, to support that as a supporting document whenever we submit to the STIP funding process there. So the study not only supports the interchange at Baltimore Road, but it allows us to look at those improvements along 158 at Baltimore Road, as well as 801 and 158. As you've seen with the projects there at Farmington Road and the Baltimore Road project, I've already submitted those projects to the Winston-Salem MPO for the interchange, as well as the Farmington Road project to our RPO, just based on these preliminary findings here in our presentation. So this will continue to support all of those improvements as we move forward with our future years there. So.
Well, back to the numbers for a moment. I would assume that if the Baltimore interchange was done first, that would relieve quite a bit of traffic going through 801.
It does, and that's what I'm saying is that those improvements are all based on this improvement at Baltimore Road to account for those additional numbers. You're still going to have that amount of traffic volume going through 801, 158 with the 801 or the Baltimore Road interchange going through there.
Yeah, and we studied, our analysis in here has the diversion of traffic due to the new interchange. So it's not like we added the interchange and then kept traffic as is Farmington.
Okay.
And 801, we would divert some of that traffic to develop traffic volumes for the new interchange.
So, and that's really the reason why we went down to Farmington Road, because we were seeing that amount of traffic going, not just because of the high school, but because of all the other traffic trying to get in and around to avoid those areas. That's the natural next exit to go to there. So that was the other reason why those improvements need to be done on Farmington Road.
As looking at the next steps there, do the county, obviously we can get together and figure out our endorsement, but do we need are you looking for a joint endorsement, or how's that going to work?
We wanted you, as the Board of Commissioners, to endorse first. This would be presented to the Bermuda Run Town Council in August, and then we'd make our final presentation to the Winston-Salem MPO for their approval. So,
Is funding for a fast lanes grant independent of, or I guess going the other way, state funding of the Farmington Road and the 158, 801 project was a state project? Would that funding be independent of the fast lanes grant if we were successful in getting that?
Yeah, the Fast Lane grant is a separate funding source. rather than state funds. It's a federal fund.
I understand it's separate, but they wouldn't make it dependent on state funding for,
For the other two,
right.
I'm not 100%, but I don't see why they would.
Well, to me, one of the things about, I don't have any problem endorsing it, but I would like to have some idea about what it costs before I make any really formal endorsement about it. Is there any way of knowing that?
No, I think this is the very first step, and that's not what the study was really about. The purpose of the study was, is it feasible to meet, DOT standards, federal highway standards, to put another interchange between Redland Road and 180. So, and that's what the study suggests is, or shows, is that, yes, it is feasible to meet those standards to have an interchange there between those two areas right there.
Are we endorsing a concept there, not a project?
Right, and this is the first step to get anything done for an interchange.
All right.
So we have to do this.
I'm okay with that.
Yeah, it's a whole process to go through NCDOT and FHWAs. This is step one. Any further questions?
So you need us in August?
No, I mean, you can do it tonight. The Bermuda Run.
You want to take it to Bermuda Run in August?
We're taking it to them in August, and then we'll take it to the Winston-Salem MPO.
We would have an August meeting before
Right.
Bermuda Run meeting.
Because, and with the project to the Winston-Salem MPO, I need local support. I'll need a letter of support from you and Bermuda Run to be submitted into that as documentation with our project.
Mr. Chairman, I'd be happy to work with all of you in your work groups regarding this, so you have time to review the packet that was brought tonight and take action in August.
All right. Thank you for your time.
Thank you.
Here's that.
Right. Next, we move to a presentation about an update on behavioral health services. Call on Ms. Rhonda Outlaw from Cardinal Innovations.
Mr. Chairman, before she gets started, I just want to say Ms. Outlaw has been a tremendous asset to Davie County in helping us through the transition. You're going to hear tonight about enhanced behavioral health services in our county, which for many years have been a continued conversation and discussion. But she's been a great partner to us and our friends at Public Health and Social Services and others as we talk through what this might look like in our county. So we're excited, and thank you for being here tonight.
Thank you. Well, thanks for having me. As you heard, I'm Rhonda Outlaw. I'm the Senior Community Executive for Cardinal Innovations in the Triad region. And the Triad region used to be Centerpoint Human Services, as you may know. We are responsible for managing publicly funded Medicaid and other publicly funded behavioral health services. So what I'd like to do tonight is give you an overview about what's happening with Cardinal Innovations, about some of the local initiatives that are going on since Centerpoint merged with Cardinal Innovations last summer. So I'd like to speak briefly about who we are and who we serve, and how our philosophy of whole person holistic care, coupled with the concept of a local presence, really gives us at Cardinal the ability to have staff here in your local community working in partnership with the local, with the local agencies in such a way that you can see real concrete improvements in terms of the lives of the people that we're charged with serving at Cardinal Innovations, but also within your local community itself. You're going to also be hearing more from your Public Health Director, Suzanne Wright, who will talk with you in some detail about one of those collaborations that is an exciting, wonderful new county-operated clinical behavioral health unit. So that's what John is referencing. Let me go the right direction here with this. Okay, oops. So back in July, last summer, Centerpoint Human Services merged with Cardinal Innovations to become the Triad Region. And the Triad Region includes the original 4 counties of Centerpoint Human Services. So in addition to managing behavioral health services in Davie County, we're also responsible for managing services in Forsyth and Stokes and Rockingham counties as well. Cardinal Innovations is one of the state's 7 managed care organizations. We at Cardinal are the largest specialty health plan in the country, serving over 850,000 individuals, most of whom have very complex behavioral health and other needs across a 20-county area in North Carolina. We coordinate care for those members through a 24/7 access line that is manned by licensed clinicians who can take calls from individuals at any hour of the day or night. They can refer for services and provide an immediate appointment, and they can also intervene when people call that number in the midst of a serious emergency. Our care coordinators are also local and on the ground here in Davie County. They work very directly with members and their families, and so that is a function that really is the most helpful for individuals because they've got a face-to-face contact with a person who is linking and coordinating all of their care. At Cardinal, we have contracts with over 1,000 providers across the 20-county area. And those services delivered by those providers range from traditional outpatient psychotherapy in an office to home and community-based services, as well as hospitals and detox facilities. This is our footprint. You'll see the 20 counties there, and the Triad region, of course, is those 4 counties in pink up at the top. The red dots indicate places that we have community offices, and community offices is something of a misnomer these days because over 50% of our staff are mobile. They don't report into an office each day. They're actually out in the local communities where people live and work and enjoy their lives so that we can really be in the community and understanding what the needs are and what's going on and how we might be able to work together collaboratively. Also, in the Triad region, we have something that's a little different than what's present in all of the other regions of Cardinal, and that is we have wellness centers in each of our 3 rural counties, including Davie County. So the wellness center, yours is located over on Gaither Street, provides a local presence and a place for our staff to kind of light down if we have meetings. It's also the site of, it's really a community facility, so it's a place that AA meetings can happen, NA meetings can happen, other kinds of community events, and as well as training and education. These are some of the specialty populations that we serve. And as I mentioned, typically the folks that we provide treatment for at Cardinal Innovations are people who have multiple severe conditions and very complex needs. Typically, the clinical presentation is a very complicated one with a need for very specialized kind of treatment options that require specialized expertise. And we think we have that special expertise at Cardinal Innovations in the public sector. Now, our CEO calls it the hard Medicaid, as opposed to, I guess you'd say, the easy Medicaid, if there is such a thing. But the folks we work with are the folks who have the most intensive level of needs and are really the most difficult to treat. At Cardinal, we're very focused on holistic, whole-person care so that we consider what the person's needs are, not just in terms of a mental health diagnosis, but also all of the different aspects of their life. So we want to look at the physical health, the economic status, their social and cultural needs, to really go beyond just a mental health diagnosis and take a look at the whole person. That's what we mean when we say holistic care or whole person care. You'll also call it integrated care. We think the best way to do that, and really the most effective way to do that, is by working in partnership with other agencies and entities in the community. And so that leads to our local presence, which is sort of how we do that. So with this philosophy of looking at the whole person, coupled with a local presence, that's how we are essentially different from other insurance companies in the private sector for sure. And we think also, frankly, different from other managed care organizations in the public sector as well. Our merger with Cardinal Innovations brought us additional resources. So in addition to that care coordination function that I mentioned, where our staff are working directly with members and their families, we have 3 departments that target different sectors of the local communities. And those are community relations is one of those, and that's my role, where I work closely with your county management and elected officials, plus the senior level directors of our partner agencies like Public Health and DSS. Our community engagement staff provide training and education to members and their families, to providers, and to the local community. And our member engagement department is available to help individuals and their families navigate what is really a very complicated system. So if people just get stuck and they don't know how to access care, or if they want to file a grievance, those kinds of things, these member engagement specialists work directly with people to support them in that role. And now I'd like to highlight some of the local partnerships that are really making a concrete difference in your community here in Davie County. The first of these is around your county funding for behavioral health services, known as your maintenance of effort dollars. This year, for the first time, Cardinal Innovations approached the counties and asked to have a discussion about these funds, which historically it was sort of a legacy funding. You know, we didn't really revisit every year. The county provided the money, Centerpoint managed the money, and we thought a better way to do that is to talk directly with the counties, to look at those allocations and really make some decisions about how the funds can best be used to target what you in this community see as your most critical needs. One of the outcomes of that discussion this year with John Eller and others was a decision to use your MOE funds to support a county-operated clinical behavioral health unit that will serve children initially. And you're going to hear some detail about that from Suzanne Wright in just a bit. These services are very much needed as an enhancement to our local contracted provider network work, which frankly is not adequate to serve the needs of children. So in addition, it's helping us, it's helping your community, and we are very, very grateful for the opportunity to be part of that and to support this initiative. Another example of some of the kinds of community collaborations we have are our Davie County Community Partners Meeting, and we invite you to attend this meeting. It is a monthly meeting that brings together local human service agencies for mutual problem solving. And you can see the list there of some of the entities who typically attend. We have excellent attendance, and I can tell you we have some robust discussions in those meetings because it's about problems and how we can work together to make it better. And the goal in that meeting is really not just to identify problems, but also to brainstorm about how we can work together jointly to bring improvements to this community. We're working to strengthen child services, particularly through our collaboration with Davie County Department of Social Services. Many of the children and families that are served by DSS have behavioral health needs. So our goal is to make that interface between the two agencies be as smooth as possible for those children and their families. We fully expect that your new clinical services unit is going to improve access and quality of care for this population. And then lastly, I'd like to mention our Access Call Center. This is a 24/7 toll-free line that people can call to be referred for services. Our clinical staff do a brief screening on the phone. They give people an appointment during that phone call, and they're also available to respond if there is an immediate crisis. So I think I'll stop here and take any questions that you might have before Suzanne Wright talks to you about your new clinical unit.
The only thing I would ask you is if you could make sure, John, that we're notified of these meetings.
Sure.
Can't attend them all, but it'd be nice maybe to attend one every once in a
Okay,
while.
that'd be great. We'd love to have you. You can just pop
Send us a
in.
notification. Yeah, that'd be great. Thank you.
All right. Is that it? Okay, thank you.
So while we're getting geared up here for Suzanne, I will tell you that as we started talking about what the gaps were in this community, there's many gaps, but one of which was services to children and families, many of which were waiting weeks to even be seen. And in the mental health and behavioral health world, until you have that initial assessment, you can't access services. And so we started putting our heads together and figuring out we're already having to meet a maintenance of effort. How can we utilize our money and maximize our deal with the need that we have and maximize those dollars, but also really create what we think is something special that fills a gap. So I'll let Suzanne talk about that, and can't commend her and Cindy Austin enough, for which I'm sure she'll introduce shortly. So thank you, Ms. Outlaw, and turn it over to you.
Okay, so Rhonda mentions in her presentation county-operated clinical behavioral health services. And so I want to give you the backstory behind that. And it all started in January. We get a new county manager in January. And that's also when budget planning for the new fiscal year starts. And that's when the maintenance of effort is addressed too. And so they decided we need to start prioritizing our needs instead of turning around and writing a check to Cardinal every year. So we started prioritizing our options by getting an email from Robin West. She sent it out to all the department directors and said, need to know what your behavioral health needs are. So that was the email that we received. And so within about a week's time, I get an email across my desk. Same week in January, I get an email from Injury Free North Carolina Academy. I'd never seen that before, ever in my 8 years here. And it was announcing application registration. You could apply to go to this academy. And so I clicked on it to see what it was about. And it's a partnership between UNC Chapel Hill and the Injury and Violence Prevention Branch at the state level. And so they've come together to really look at evidence-based strategies around injury prevention and training coalitions from communities on how to address injury and violence using these evidence-based strategies. So we applied to go to this academy. I forwarded it to Brandy Patty. She applied on behalf of the county. We were one of 5 teams from across the state that got accepted. And so we took partners from domestic violence, Dragonfly House, the sheriff's department. Well, we were going to take somebody from the sheriff's department, but they were unable to go with us at the time. And and public health. And so we took representatives from all 5 areas, and we come up with a plan. Our plan to go was to, and I can't see that, and I apologize, was to prevent generational violence and strengthen systems and resources that touch children and families in Davie County. And that was our original plan. And then sometime in the process, I get an email asking me to come discuss behavioral health at the county administration office with county finance and HR. And so it was there that I learned the backstory about the maintenance of effort funding and about the fact that we were prioritizing our needs at the county level. And so I saw some of the needs that were identified. And so they asked if we could somehow research how we could create either a standalone behavioral health unit or a specialized unit under public health, or to see how others operated across the state, either through under DSS or under public health, or how these operated. So we started doing a little research. Well, right after that, we go back to Injury-Free North Carolina Academy. And at the academy, they asked us to draw a picture of Davie County based on our statistics. And so they didn't say how, they didn't say what to put on there. They just said, take your statistics and draw a picture. So we drew a picture of the school system, talked about our really good school system. We talked about our faith-based community, but the churches. And then we talked about our problems. We talked about the prescription drug problem. We talked about our illegal drugs and the heroin. We talked about the fact that our suicide rates are increasing among school-age children, school-age girls 11 to 20. We talked about the motor vehicle injuries and accidents and the motor vehicle deaths on 40. We talked about the number of domestic violence cases last year, 427, and that our suicide rates always trend higher than the state average. And so they ask us to put these things on paper, but also ask us to identify community partners that touch these problems on a day-to-day basis. And so we listed those and drew these on the map too. And that was very helpful for us to see all that. The statistics that weren't included were the ones from Dragonfly House and the ones from the Sheriff's Department, because Randy Reagan got sick and had to go home, and then the Sheriff's Department staff couldn't attend that day. So when we got back, we also pulled together the highlights from the departmental assessments. And what those showed was that DSS reporting having 2 behavioral health providers in the county that took Medicaid patients, Medicaid clients. Both are either at capacity or over capacity most of the time. There's usually a 6 to 8 week waiting period for comprehensive clinical assessments. And that last year, one child, it took 28 days to get a comprehensive clinical assessment and placed, and that one child cost the county $7,000. And so it also identified that there's a growing need for family services around children with behavioral health concerns. And basically, there's no secret, from a community health assessment back in 2007, it said that the mental health system in Davie is weak. And that's been a consistent theme since I've been here. So I think Mr. Eller had a vision when he first asked us to assess our needs. I think he had a vision. And I think when the email came across my desk about Injury-Free North Carolina, I had a plan in my head. After meeting with all the groups from Davie County, we all got together and had a plan. We sat down and talked with everybody in the room and came up with a hybrid plan, and that's to create a specialized outpatient behavioral health unit under public health. And it's going to serve overflow as an overflow provider for children aged 3 to 18 and their families. And overflow means it's not going to take the place of any of the providers that are already here serving kids. It's just going to be that safety net provider. It's going to be in addition to what we already have. So there are 3 short-term goals, and that's to improve efficiencies and decrease waiting times for comprehensive clinical assessments and foster care placement, to increase access to mental behavioral health services for families and children in Davie County. And one of the main ones is to provide comprehensive wraparound services for children identified through these systems. And it was interesting when we drew that picture at the academy. Each one of those departments touched these problems individually, but we're not wrapping around it. And so that's one of our short-term goals. Our long-term goal is to prevent generational abuse, neglect, and violence by addressing and treating the root causes. And that's the part that was missing from the original plan. We didn't have the behavioral health component to treat the root causes. And so while also strengthening parenting capacity, community partnerships, and resources to support safe and healthy family units. So to give you an update on where we are now, we have a staff member hired. We have a director of clinical outpatient therapy. Her name is Cindy Austin. She's a licensed clinical social worker with TFCBT certification, which is fantastic. We are currently hiring for two human services counselor, two positions, and one part-time position. The location is going to be at the shared facility with domestic violence and the other half of that duplex. We currently have renovation plans going on there. We're going to be working with our community partners immediately following this meeting. We're going to be setting up meetings with them to talk about the referral process and when we're going to start taking clients. So we'll be scheduling those meetings immediately following tonight's meeting. And we're looking to start in August. We're going to start taking referrals in August, but a lot of that depends on when we get the signed contract back from Cardinal. We have the acceptance letter saying that we're in their provider network, but we don't have the hard copy of the contract back yet. So as soon as we get that back, then we're on go. So we're really not going to call it County-Operated Behavioral Health Services. We're going to call it the Nest Family Counseling Center. And the reason we chose the Nest is because it speaks to security and safety and bonding, connection, care, and growth. And the acronym is Nurturing, Equipping, Strengthening Together. And I want to take you back to the picture that we drew at the academy. They didn't give us any instructions on how to draw this picture. They said, draw your statistics, put your statistics in a picture, and put your protective factors, put your community partners and protective factors in the picture. We started building our nest then because we put our protective factors on the outside, wrapped around our problems on the inside. So we started building it then, not realizing it. So the services that we're going to provide, like I said earlier, is going to be a catchment for children and families. And that's the key right there, children and families. We can treat the child and the behavioral issues with the child, but if you send them back into an environment that's unhealthy, then you're not really fixing the problem. So we're going to provide comprehensive services for the child and the family. But for those that have been placed on waiting lists or unidentified or screened out for services, we're going to provide the CCAs for social services. We're going to do individual, family, and group therapy services. We're going to provide these at home, at our office, or in a school setting, or wherever is needed. And again, the cost is going to be built into what you've already paid. There's no additional county cost. It's built into the maintenance of effort funding that you were already paying to Cardinal in the past. So we're keeping that funding to use toward the specialized unit. And we've also been credentialed with Medicaid and with Cardinal and other insurances so we can generate revenue with this program as well. There should be zero additional cost to the county. So, any questions?
How will this, and I know this is a broad question, how will this improve the channel, so to speak, for fostering, for foster children? I mean, are there roadblocks in place now that it slow down the process?
I think that's what Tracy and I talked about at one time. I think the wait time to get a comprehensive clinical assessment was so lengthy that it took time to get placed. And I don't know if Tracy wants to speak to that or not. Sure.
Suzanne, what she said is absolutely correct. The behavioral health unit will help tremendously with our services for our most vulnerable children and families because it'll be immediately available. Currently, there are some services available, but there's always a waiting list. And with this, with our own clinical unit, we believe that it will drastically cut down the wait times. And that CCA is the key to all other services for that child. Until we get that done, then usually, if they require a higher level other than traditional, then it's on a county dollar.
So that's the spillover. In other words, that's where those children won't have that 28-day wait.
No.
There'll be immediate.
It's an immediate referral.
That was when we created this unit with our partners at Social Services and Health and others. We really wanted to create a place where people wouldn't fall through the cracks or have to wait. So, I mean, our hope is same day. Worst case,
Right.
24 hours. but to place a child in a foster home without having an assessment done, isn't good for the child, nor is it good for the foster parents. And so we want to screen those children and triage early on in the process, and everyone wins if we do that correctly.
I don't have a question, just a statement for the, when Mr. Eller came, he made, early on, this is kind of repeating what's been said, he said we can take these dollars that we're spending and we can ask the question how we spend these dollars and get a better outcome. And I was like, sounds good. And then, but where this has came with all the interaction with Cardinal and certainly social services, and Suzanne, you're always very innovative. I go back to the walk-in clinic that you came up with. This is great, and having been on the Centerpoint board, behavioral health, it's an underserved area. There's no question about that. So I think this is a very good thing, and I appreciate Mr. Eller's vision here and thinking outside the box. So just wanted to say that.
Absolutely. Okay.
Thank you.
Just say thank you to Cardinal for working with us on this, Rhonda. When can we expect to get that contract back?
Sam was pressing me about it. I'm pressing on our network management folks to,
Good.
to make it happen. But Cindy has been credentialed, so she's good to go. We just got to get the contract signed, and we're expecting it back, hopefully, before the end of the month.
And we're meeting with our network folks Thursday.
Yeah,
So
and I think
hopefully.
there has to be a site visit, maybe, just some details, but it's going to happen.
All right, thank you.
And one more thing
We're all
before
anxious.
we did fail to mention one thing. Susanna's going to be pulling together our community partners to talk to them about how the referral process is going to work. Once we get this back from Cardinal and we're ready to go live, as she mentioned, our schools can make referrals for children they're concerned about. Smart Start, social services, the health department, local nonprofits, juvenile crime prevention, and any of the medical offices. So this is a pretty robust thing. So any child in this county who has an identified need can be referred to this unit. So that's for your knowledge as constituents approach you, and for those in attendance as well.
I think one of the beauties of this is, sorry, Suzanne.
Yes, sir.
We have all these agencies been working, in a good way, but now they're all committed to working together. And there's so much overlap, and it's going to be, I think, so much better once we have that vision realized.
Yeah, we've all been touching it, but we've not been wrapping around it, so I think it's going to be great.
Thank you.
John, is this information getting out to the providers, the doctors, so?
It will be, absolutely, because we anticipate they will be a referral source.
Right, I think that's important, particularly the pediatricians in that group.
All right, thank you. All right, next we have a presentation about the agreed-upon procedures from the fire departments, and Ms. West is going to share the findings.
Yes, good evening. I'm going to give you an update on the agreed-upon procedures for the fire departments. This is just a brief timeline. As you recall, for fiscal year 16-17, the county budgeted about $30,000 for what we thought at the time would be audits for the fire departments. But we decided a more focused approach with agreed-upon procedures would be more cost-effective and appropriate. That would give us a bigger bang for our buck, so to speak. Given that we give over $2.4 million to our volunteer fire departments and rescue squad of taxpayer money, we wanted to have more accountability on the use of those funds. So we, on April 6th, advertised a request for proposals and had a deadline of April 26th. And as you recall, on the May 1st meeting, this board approved a contract with Barton Starnes and Associates to do the agreed-upon procedures at a cost of $2,000 per department. And we tested 3 departments for a total of $6,000 for fiscal year 16-17. They came out and did the field work on May 21st and stayed for a few days, and I want to thank the fire departments that were chosen for their responsiveness. They all had their records here and were very responsive to the inquiries. Last week, we got a preliminary draft of the results, and I've attached that to the audit, to the agenda packet. And Hopefully by the end of the week, we'll have a final draft. There was some new standards relating to agreed upon procedures that the auditors had to send out some more engagement letters and some more language and have everyone sign it. So it's in the final stages at Martin Starnes in the final assembly process, and we hopefully will receive that by the end of this week. And as far as the results go, for the three fire departments that were chosen, Advance Center and Kernatzer-Doolin, the auditors compiled a statement of cash receipts and disbursements. All cash disbursements were scanned for items unrelated to fire operations, and all disbursements to board members were tested and verified. They looked at all the cash receipts that the county sent them, and they also reviewed a certain percentage of disbursements. And the results, as you can see in the preliminary report, is that there were no findings in each of those three departments. So that's very good news. Where we go from here is we're going to test one large and 2 or 3 other departments for the fiscal year 17-18. That field work we're planning on happening between January and March of 2018. And we still have the amount of the contract is $2,000 per department. So that'll be $6,000 to $8,000, and that money was included in the approved budget. And I'll be happy to answer any questions if you have any more.
Anybody have any questions? I want to thank the fire departments that were selected in the initial round for their cooperation, and this will be an ongoing process, so we'll think we're on the right track with this, and we'll continue over the next few years. So, all right. Next, we have a public hearing on the closing of Peter Hairston Road. Mr. Meadwell.
Thank you, Mr. Chairman. If the board recalls, in May, this board received a request for application to vote to approve the abandonment of state road maintenance for Peter Harrison Road. In June of this same year, you received an application or a request for the final abandonment of that road. And at that meeting, the board set a public hearing date as required by statute to be held at least 1 month out. For that, the property had to be posted for at least 3 weeks, notices sent out to each of those surrounding property owners. And the action that the board needs to take tonight is that if you find that the road closing is not contrary to the public interest and that no individual owning property in the vicinity of the road would thereby be deprived of reasonable means of ingress and egress to his property, the board has the right or may close by order close the road for Peter Harrison Road. So that's where you are tonight. You are actually taking public comment on that actual closing tonight, and based on that, what you find tonight, you can order the road to be closed permanently. So, any questions? We haven't received any kind of calls or comments from anyone regarding the request. So,
All right. This is a public hearing as advertised. I'll turn it over to Mr. Vogler.
Chair has announced this is the hour and date for the public hearing on the proposed to close the public road known as Peter Harrison Road, a public road number 1812 within the county of Davie. There's been due publication, notice of public hearing in the newspaper, general circulation in Davie County is required by section 168-20G of the Act, and the clerk to the board has attached the affidavit showing the publication of said paper on a date at least 10 days prior to this hearing. I'd ask anyone who wishes to comment at this public hearing to come forward to the podium, state your name for the board, and then comment on the proposal. Mr. Chair, seeing none, come forward. I would now turn the public hearing back over to you as chairman, closing the public comment section of this public hearing, provide the board the opportunity to discuss among yourselves what, if any, action you wish to take with regards to this matter.
Okay. Thank you, Mr. Vogler. At this point, we'll declare the public hearing closed. Any questions, comments from the commissioners?
Mr. Chairman, I would go ahead and make a motion to approve the order to close.
Okay. A motion, to have a second?
Second.
Motion and a second. Any further discussion? Seeing none, all in favor of closing Peter Harrison Road, raise your hand. That passes 4-0. Thank you. All right. Next, we move to the consent agenda, which we've already had some discussion about. Anybody have any other questions or concerns about the consent agenda? As amended. Seeing none, entertain a motion to approve.
So moved. Second.
Motion and a second. All right. Any other discussion? Seeing none, all in favor, raise your hand. Consent agenda passes. All right. I move to the county manager's report. Mr. Eller.
Just a few things quickly, Mr. Chairman. Again, I'd like to thank Ms. Wright, Ms. Murphy, Ms. Austin, all the agencies involved in the behavioral health presentation that you heard about tonight. As Mr. Moore said earlier in his presentation, our Independence Day celebration, I've received multiple positive comments about that from citizens and the town. So thank you for staff for what they did in preparation for that. Amanda Aker attained her certification for Parks and Rec designation, and we want to commend her for that. And then also we had a milestone last month or last year. Mr. Lambert is here with utilities. We broke the threshold of 1 billion gallons of water produced. So I think that's a big deal. So thank you, Mr. Lambert, for what you and your staff do. You may have noticed on social media, we have our strategic planning survey that's out there. We have been meeting with various community people, and we're compiling the recurring themes, and we've put them out there to see what the community thinks about those. So that's out there for anyone to comment on as we begin to pull some things together for you to respond to over the next few months. Our high school, the new high school is on time and on budget. I was asked to remind the board and the public that public tours and a ribbon cutting ceremony is going to occur on the 17th of August. That's going to begin at 3:30 as far as the tours go. A ribbon cutting will then follow at 4:30, and then additional tours will pick up at 6 o'clock. So I just got that today, and I'll make sure you're aware of that. Board, I'll email you on that, but just for the general public's knowledge. I commend our staff for getting our EDA grant in for East Davie Sewer Project. All those involved with that project just put a ton of time and effort into that. Also like to commend our what we did tonight with the River Park, Town of Coolmey, and Bullock developers in South Yakin Power with getting to the Phase 2 process of our River Park. And then last but not least, we recently held our first meeting to have discussions about human services consolidation among domestic violence and rape crisis, our veteran services, senior services, social services, and public health, just to talk about what programming could we do better in a shared approach and see how efficient we can be with the dollars that we have. All those departments do a fabulous job, and I'm really leaning on our department heads to get us to a good recommendation to come back to you with. So we hope to have that here over the next few weeks. So I just want to thank those department heads for working with me through that process as we try to make the most informed decision we can. Just want to say our condolences to the family of Kurt Dickens, as you've already heard, and his wife Karen and the family. And then lastly to say congratulations to Ginger Broadway, who has celebrated this week 30 plus years with the county. So with that, I'll conclude, Mr. Chairman.
Okay. Thank you for that. All right. Do we have any old business to come before us this evening? Okay. How about any new business to come before us this evening? All right. We'll move to Commissioner's comments. Mr. Jones.
Thank everyone for being here. Just briefly, a long time coming, but the discussions on the River Park and what we are doing there, I just want to thank all those that have come together and have finally had an open dialogue on this issue, and I think great things are going to occur out there. What you're doing now, I think, is just maybe a first step. I think there's a lot of things that can happen for that community, and just thank you all. Paul, thank you guys. I know July is Parks and Rec month, but not only to you and your staff, but also to the committee that's working together to get Parks and Rec going on a county basis here in Davie County, the repurposing of the high school. Thank you for all the hard work you guys are doing. We really appreciate it. And again, I'll just reiterate what the chairman said about the work that was done on Suzanne and John Cardinal, the folks from Cardinal. I will just put quotation marks around the thinking outside the box statement. That type of vision is good for all of us, great for the county, and I appreciate all your hard work there. And again, just thanks to all our staff, to all our community for making this the greatest place to raise a family in the state of North Carolina, in my opinion, the United States. Appreciate you all.
Mr. Barrett.
Well, thank you all for being here and for all the staff that does such a great job. Johnny, we're going to get to 2 billion gallons next. Don't want to be here if that happens. I was very moved, Suzanne, with your presentation, and I think, you just articulated the need that's being met by all our agencies working together cooperatively, and so thank all of you, social services, Davie Domestic Violence, law enforcement, so many different groups working together for important cause. Echo Commissioner Jones's comments about the resolution we have now, and I'm so pleased for this. It's been a long time coming, but the stakeholders have gotten together, and I think we have a resolution that perhaps is going to move everything forward and in a positive way. So we look forward to working with you as a partner. Thanks to the River Park Board and to the town of Coolamy for all your cooperative work on this. The behind-the-scenes discussions were just awesome, and I think it came to fruition tonight. Recreation and Parks, Paul, thank you, and Amanda, congratulations for your accomplishment. We're really moving in a great direction there with Rex and Park. And really, all our staff, we're so blessed to have such a wonderful staff and everybody working for the greater good of the county. Our heart and condolences go out to the family of Kirk Dickens and in this time, and know it's very hard, but we know that all our prayers are with that family tonight. So thank all of you.
Okay. Mr. Ferguson.
Well, I would just like to echo what's been said about our staff and all the people. I see you out there quite often, and because I'm out and about the county occasionally, and I know you all do a big job, and it's a lot of work. I saw in the paper just this morning where there was some information about the counties around us were foster children, and I noticed that there was a number that hit me in Davie County. We only had one in one category, and I thought that was a very, very good situation to have, because most of the other counties their numbers were much higher than Davie County's. So thank you for all you do, and thank all the staff for all they do. The staff, some of you work 8 to 5, but I know your job is much more than 8 to 5. You're thinking about what you're doing, and you're called out a lot of times, so there's a lot more hours than 8 to 5. There's not many people that get an 8 to 5 job anymore. So we appreciate everything you do, and thank you. And I know you want to go home tonight, so I'll be shut up.
I'd like to thank everyone for being here. I certainly echo all the comments that were made tonight. But to our staff, don't say thank you enough, but anytime we have an issue and we need to come together and work together, you do that, and that's a great thing. So, and work together for the greater good, as Commissioner Barrett said. So, we just thank you. So, with that, entertain. We'll hope you'll come back next month. So, and we'll be here, I hope. So, with that said, entertain a motion to adjourn. Motion.
Second.
Second. All in favor? We are adjourned. Thank you very much.